Hello, everybody, and welcome to another episode of the Practice Pulse podcast. I am your host, Dr. Aditi Agarwal. I am a practicing dentist and co founder of Practice by Numbers. And today I have the pleasure of speaking and sitting down with Dr. Rehan Shahid. He is a fellow dentist who is currently practicing, he's an entrepreneur and co CEO of Multi Practice Dental Group. He's also the founder of Practice Success Academy, which helps dentists buy back their time and scale their practices through transitioning from being day to day operators to true CEOs of their practice through leadership, systems, and data driven accountability. Welcome, Rehan.
Yeah, thank you, Aditi, so much for bringing me on. Looking
Yeah.
forward to it.
Absolutely. So tell me about your journey. I know as practicing dentists, I know where we both began,
Yeah.
but how did we get to wanting to do more and be more of taking on a CEO role in your practice?
So I started in dental school, and almost day one of school, I realized I didn't want to just be another doctor, right? There's so many of them out there. And just from my background, my parents used to own a gas station growing up. So we kind of learned the business when I was 7 years old. And from just kind of being an entrepreneur mindset, always in inside the business all the time and anything that I was doing, that was always my passion. Hey, I get to be the doctor, which is cool and I enjoy it. I get to serve people, but then I wanted to taste that business side too. And that's what kind of led me to day one. Hey, when I was graduating dental school, I want to be a business owner from day one of graduating. So literally after graduating, I think 2 weeks after, I became a practice owner. So I got to
Wow.
hit that goal.
Wow, congratulations. That's a big leap. And it's so interesting that you approach this so differently. Most
Mm.
of us, right, when we go into dental school, we just want to become a great dentist. And when we come out of school, definitely in my case, I was not thinking about being the best business owner. I was just wanting to, you know, hone my skills in dentistry and be the best dentist. But I love the fact that you were so forward thinking and you thought about it that I'm going to approach it differently. I want to serve people. I want to be the best dentist, but I also want to be a true business owner, which to me, my mind is blown. That's amazing that you went into it
Yeah,
different.
it wasn't easy. I think just, with my whole class, everyone was going to be a dentist, right? But all that depends on our two hands. And the moment they're done, you're done. So I always had to think, what can I do to set myself up for a long term success that wasn't purely dependent on me? And that's where the
Mhm.
business part came in.
That's awesome. So, how did you take that first step?
I think the first step, some people call it a curse. I call it a blessing. COVID happened, unfortunately, and we got so much free time. So I'm a COVID grad. For those that don't know what that is, we graduated during COVID, and so with all this free time, we had months of just sitting at home and doing nothing. And for the first couple of weeks, I was watching TV and enjoyed my whole vacation. But then I was like, I just feel like my brain is just rotting. Let me go and be productive. And so I started listening to podcasts. This is an amazing podcast. So people that don't listen, podcasts are great. I started reading some books. I mean, there's like 200 books behind me. I read almost every single one of them, and I just realized I wanted to make my time productive and take that first step, which was to buy a practice. So I literally read a book called How to Buy a Dental Practice by Brian Hanks, and I just studied that. And I read more books on business and dental, and I just started to develop that passion. And I felt I was ready day one of just when we got back in. I was like, hey, I'm ready to buy a practice. So that was my first step, just really getting the information load of how to do it.
That's awesome. So, tell me your timeline. You graduated in 2020, correct?
Graduated 2020, bought two practices in 2020. So within
Oh,
graduating, yeah, so one like 2 weeks later, one 2 months later. 2023, I believe we bought another one, and then 2024 we bought another one.
that's
Um,
awesome.
and and now we're in our stabilized year and growth year, so we're doing more expansion before we grow more. But then looking forward to 2027, if not Q4 2021 or 2026, buying another practice.
Nice, nice. So, tell me what, from your perspective, really separates like a clinic operator, right, from a CEO, a true CEO? What's that shift, and what happened with you personally?
Yes, I think the first thing is mindset. Uh, the clinical operator, we think from a dentist lens the whole time. And what that means is where we do procedures, we run the show, we, and it's always that person. The CEO mindset then enters a game where it's not, me. It's how do I make everyone else around me elevated in their skill set to be able to lead with them instead of relying on me the whole time. So that was my thing. It's, to be the best leader in the game, how do you make everyone else amazing leaders so then you can buy your time back and step away? So for me, that started with reading a book called Buy Back Your Time. It's one of my favorite books. It literally is how to buy back your time. And just from that book itself, I got to learn what was my value of time. And, as a clinical operator, which I still practice some days clinical, I realized for me to help lead my company doesn't need me to go do dentistry. They need me to help them grow and how to be a better leader and how to teach them how to sell more cases and how to just grow and beyond the levels that we're at. And so clinical dentistry, everyone can do, right? You can go hire a new grad to do dentistry tomorrow, but not everyone can lead a practice or even grow a company. So that's where I knew I wanted to focus most of my energy and time on.
And how did you do that?
I started with just being being in the right room with the right people. So there's a quote that my dad always used to tell us: you stand on the shoulders of giants, meaning I'm not here by myself. I got to learn from amazing mentors. I got to learn from people that I never met, from books, from podcasts. I got to just connect with people that are really good at what they do and just literally, uncensored, ask them, hey, my goal is to be like you. Tell me exactly what you did so that I can just be a sponge, absorb it, and go and do it. And that was it. Just being in the right room, be a sponge and just listen and just go execute.
That's awesome. That's awesome. So, what are, in your experience, some core sort of systems that you think every dental practice should have in place that helped you scale?
I believe the first one from us was the ability to sell anything, right? The ability to sell a case. So case acceptance it's a skill set. It does take practice. People aren't naturally born with it. I think that's the first thing, because you could have these most amazing clinical dentists, but if they can't sell anything or their office can't, then the clinical skill didn't matter. So first of all, for me, it's the case acceptance, the ability to sell a case. Second after that would be more so on the leadership side, a cadence of meetings, because I'm a firm believer of, if we aren't meeting to talk about the issue and how to surpass it, then we're not ever getting anywhere. And so most dentists become the bottleneck because they're so busy playing clinical dentists, they never get to tackle the issues, and then they expect growth to happen magically. So case acceptance, the ability to be able to sell, the leadership cadence on how do you have effective meetings to actually grow the company and move it forward. And the final thing would be just how to schedule efficiently. I think if you want to, be a millionaire dentist, but you can't schedule as a template what that looks like, then you're never even setting yourself up for success in the beginning. So if you don't know how to schedule it, then you can't expect to get there randomly.
Right. No, absolutely. I completely agree with you. Now, that case acceptance piece of it, how did you go about setting that up with your teams?
So step one is the foundation part, and that starts with where are we at first. So we use a company called Practice by Numbers, which you're familiar with. That helps us tell us what our number is. So based on our case acceptance, we get to know where we're at. And then we get to literally look at that number every single day, every week during a meeting and say, where are we at? What do we need to get to? And how do we actually improve that? So after we know what the number is, now we get to actually practice it. So we do role play where I get to pretend I'm a patient. I get to pretend I'm the treatment coordinator. Team members get to pretend that. And then we just practice to see what do we need to do differently to sell the case, right? Everyone that shows up to a dental office, because they physically showed up, that means you've already won, right? You've already got them to pick up the phone, give you information, show up in the building, go through an entire exam. You've already mentally made them say yes. Now you just have to make it financially yes. And that's where the strategies of case acceptance and selling come in.
That's awesome. And where do you, for the layman listening, where do you find such strategies?
For the strategies of where to get the metrics, analytic software like Practice by Numbers for the actual case acceptance strategies. One is I I believe in free things are helpful. Coaches are better. But if you can't afford anything, free is always helpful. Like you can go to YouTube and find, random videos on how to sell. It doesn't have to be dental specific. And majority of the selling concepts, they're in books, podcasts, or videos, and they talk about value and influence, right? People don't come to the dentist because they want teeth. They come for what the teeth represent, which is value. And so when you're able to sell the value of something, that is what I recommend. So YouTube for free content, books for cheaper content, but still pretty much free. And then podcasts are also free, and you can learn so much from that.
That is true. So many experts sharing such great pearls of wisdom on podcasts. It
Yeah.
really is my new way of learning and expanding my horizons. So if people are not listening to podcast dentists out there, that's one thing I think both Rehan and I would be really pushing forward is please do start listening to various different podcasts. And they are very, very interesting, especially the ones on business. And they really give you a much broader uh, uh, lens on what is going on in business and in sales, and to understand that really what you are running is a business. Even though we want to serve people, we would still want to do it in a way that is successful both for your patients, your team members, as well as for yourself in the end. So I think that is one thing that us as dentists take a very, 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 very long time to understand. And then we go through a lot of intense emotions of frustration, of, feeling not good enough, our worthiness is in question. And so there's a lot of emotions that are associated with just navigating this really hard road of getting your patients to say yes. Would you agree?
Yeah, 100%. I think, we have this, like you said earlier, we have this clinical mindset that is so focused clinical that we don't get to learn the business side at all in dental school. And so we truly have to self-learn that. And it doesn't just magically come to you. You have to be proactive in how you're going to go learn that stuff.
Right. No, absolutely. So I have a question. How would you consider, or what would you do about healthy delegation? Because that is really, where it comes down to. Everybody wants to be the boss in the dental
Yeah.
practice, or you're it, right? Everybody's looking at you all the time for all the answers. So, and that can be exhausting.
It can. Dentistry is an extremely hard profession where it's a lonely profession, right? You're the person that has to do everything in the building, and we hire team members that in theory help us, but it starts with mindset first. That's step one for me. You have to be able to have the ability and mindset to let go. Letting go, and we internally as dentists, we're perfectionists, right? We want everything to be perfect. You have to be willing to accept 80%. That's kind of the rule of delegation. I would rather accept 80% of all of my work being done by someone else 100% of the time, as long as they got to do it, versus me do it, but then become the bottleneck and now everything depends on me. So phase one is mindset. It's making sure I'm mentally capable and accepting of people can take on stuff from me. Number two is then figuring out what the stuff is. And I do a time exercise where I tell dentists, write down on a day-to-day basis for at least a couple days what you do as a daily thing, what you do as a weekly and a monthly thing. And then figure out in color code which ones are only you, the doctor owner, has to do versus the things that you don't have to do, but you just prefer to do or naturally do it, versus three, the other code, someone can take this on no matter what that is. And the goal is to do the things that you have to do and only you can do, and everything else should be delegated.
That's
So
awesome. That's awesome. I love that. So I love that you color coded so that you kind of really can see it. And
yeah,
then
you have to see that visual, or everything's still all in your head from I have to do everything.
yeah, yeah. Because once you see it, you can't unsee it. And
Yeah.
so
And I'll give you an example. So most dentists right now, for example, they run their own payroll, and that's something that the dentist, that's as a middle color, it can be delegated and it should, but you still end up doing it. That one can easily be delegated to a manager. You shouldn't have to run it. You can audit it. You can, periodically check it, but you shouldn't be the primary person doing it.
Right. And then also, what is the cost to you and your time if you're going to
Yeah.
do that, right?
Yeah.
And
And every dentist I say is worth $500 an hour minimum. So I like to imagine if I'm running payroll and it takes me an hour to do it, I could have paid someone $20 to $30, maybe even 40 to do that instead of myself $500 an hour. And so when you put on that lens of value, now it's a no-brainer. Hey, I don't care who's doing it. It should be anyone but me because I'm just worth so much more. I could go do dentistry for that 1 hour and produce so much and make so much more money from that.
right. No, absolutely. And I'm sure, with the Practice Success Academy, have you I know you have worked with other dentists, and a lot of them feel stuck, right? They're very busy, but they're stuck. How do you get them moving and seeing past that and understanding, what is causing that experience for them and how to, move past it?
I'll enter with an analogy. So the fastest person that could run a mile used to be like 10 minutes. And then it turned into 7 minutes. And then people were like, you're the fastest. No one can beat you. And so that was the standard. And then some random guy did it in 5 minutes. And then someone did it in 4 minutes. And so the standard was always what the number was, 5 minutes, until one guy did it. Kind of tying that back in, we don't know what we don't know. So those people that are stuck, they feel like this is the way it's always been. And until they get to talk to someone or be in a room filled with other people that have already been there but now surpassed it, they don't know what they don't know. So, and one of the things that I do is I run a mastermind group for dentists to help tackle that right there, help them get unstuck and focus. And when they're in a room filled with other dentists that have been there or even surpassed it, now they don't feel that, hey, I'm not stuck anymore because everyone around me has already done it. I now know the secrets because I get to pick every one of these people's brain and do the same thing. And so the secret sauce of being unstuck is just put yourself in the room where everyone has already passed that problem.
Right. Always look to elevate.
Yeah.
It's funny, my dad always used to say, you need to be in a room where all the other people around you are doing better than you. That's
Yeah.
the only room you're going to learn from.
Yeah.
And
If you're the smartest guy in the room, you're in the wrong room.
you're in the wrong room. So, completely agree with you there. It's very, very important to, understand that there are other people that have been in your journey,
Yeah.
and on your journey. And just many people have learned from it already. So you really don't have to go through all the pain and learn it by yourself. You can actually put yourself in this room where you can learn from people around you and be open to it. Be open to criticism, be open to feedback, and be open to being vulnerable, not just about yourself, but about your business. I think it's important to understand, like when I first with Practice by Numbers saw my own metrics, there was a lot of denial. There was a lot of like, no, this can't be possible, right? No, this is not, it's not right. But numbers, as we all know, don't lie. So, understanding that that is the actual truth, it is the fact, and maybe take a day to digest. I don't know, do what fulfills you. Eat an ice cream, go take a walk, but understand that you are looking at the truth. And now we need to understand is how we're going to tackle that truth. And sometimes it takes a lot of introspection. Sometimes it takes a lot of peeling everything that's happening in the business to be able to rebuild it in the way that would work for both, your business as well as yourself personally. So, I always say as a dentist that, when we started our practice, whether it was de novo or you bought your own an existing practice, we go in with a vision and a mission for yourself. And somewhere along the way, and I've been practicing for 23 years now. Wow. So it's been a few years and then some. And, you lose sight. You lose sight of your mission. You lose sight of your vision that you put in place, God knows how many years ago. And it's okay to understand that you're going to lose sight, and then you have to pull yourself back in and say, okay, maybe this is not the way I want to lead anymore. This is not the way I want to go anymore. And you pivot. And change is hard. Change is hard for your teams. Change is hard. And I'm talking to a lot of the mid-career dentists out there, because I'm a mid-career dentist. So I know your pain. I feel your pain because we are so used to, and I'm one of those dentists who has been from analog to digital to wherever we're going now with AI, right? And changing, I think, for our teams as well as for ourselves is very, very hard. But we need to understand that in this day and age, if we don't change, we will get left behind as dentists, as business owners, and of course, as leaders in our community,
Yeah,
right?
they say the only thing constant in life is change. And like you said, you have to be able to be adaptive to that. With everything coming out now with AI, you have to be able to welcome that. Even if you're uncomfortable, you have to be able to at least be open mindset wise to see how can that help me and grow instead of prevent me from not being a part of it, which will then ultimately bottleneck me out.
Yeah, no, absolutely. Now, as someone who owns multiple practices, right, what difference do you see between, growing one practice versus multiple?
I think so. When you're a single practice owner, everything is on you, and until you adapt that CEO mindset, which is empower everyone else to help you instead of be the bottleneck of everything. When you go to a multi-office setting, you have to walk the walk. Now everything can't be on you because you can't be physically everywhere, and so I like telling people I get to literally walk my walk. I get to preach. I get to be what I preach because for me to be able to operate multiple offices, I have to have empowered leaders in every one of them because I can't physically be everywhere. And so the biggest thing that I notice and I get to practice and I enjoy is the empowering of other people and welcoming them to the table that I sit on and say, hey, I'm not over you anymore. We're on the same table because my goal is to grow you way past what I do, right? My goal is to give you strategic guidance. You're the implementer and executioner. You got to go and do everything. And my goal is to empower you with all the tools, the resources, and my personal time and guidance to help you get to that goal that we've all aligned with in a singular vision.
Yeah, no, that is very, very important. And it's very key that, you get to play the role that you want to play and that you curate it for yourself. And
Yeah.
like you said, walk the walk and talk the talk.
Mm.
So it definitely ends up being both. So for the dentist listening who feels overwhelmed, and there are a few out there, and I know, and who are really, really involved in the everyday grind of dentistry, right? What would you suggest would be one practical step that they could take this week to maybe shift and start thinking like a CEO?
So I get that question asked so many times. I always answer the same way. It's the same way you would eat an elephant, which is one bite at a time. Meaning, when you go to your office, next week, Monday, or whenever you're listening in, start with the first step of one thing at a time. And my first step is always the meeting. This is a generalized meeting where your goal is to say, hey, team, we want to be different this time. I want to be able to help you and empower everyone else. With that meeting, your intention is you want to identify all the issues and work as a team to identify all the solutions to them. What normally happens is issues come up that only the doctor is a part of, and then the doctor is the one handling everything. When you get to ask your team what their issues are as an office without blame, and when you get to ask them what they feel their solutions are without you being the one doing all the solutions, they actually want to take charge, right? You'd be surprised. Team members want the accountability and they want to own certain results. But dentists, we become bottlenecks and we gatekeep that opportunity. So that would be my practical step. Have a meeting, let the team know you're ready to change and empower them instead of being the bottleneck, and that will help grow.
No, absolutely. I love your analogy between being a true leader and a gatekeeper. I was reading a very interesting post this morning with by Dr. Brett Kessler, the past
Yeah.
president of the ADA, and he was talking about exactly the same thing. What is the difference between a true leader and a gatekeeper? And how we many times, we as gatekeepers, we are the biggest bottleneck where we turn around to our teams. We think we are leading them, but we actually end up restraining them. And how, as a true leader, it is really important for us to understand the potential in our teams and empower them to be able to give them responsibilities, to be able to let them show us how they can help us flourish. And it's a very, very interesting analogy, and that that he's talked about, and then you brought up, because I just read it this morning. It was so fresh in my mind. I was like, I need to share this. That's a very cool way of describing how we need to think about leadership. Um, and so, Rehan, if our listeners want to reach out to you and also to learn more about the Practice Success Academy, how can they do that?
Yeah, so you can always follow me on social media. Instagram handles at Practice Success Academy, or I'm always open to DMs on there. So if you follow or just DM me, I'm very responsive on there to help. And I also love being able to give strategy calls. So if you're listening to this podcast, please feel free to DM me and mention Practice Pulse Podcast, and we'll coordinate a free 30-minute strategy call on how I can help you become a better CEO of your own practice.
Wow, I love that. We dentists love things free, me included. So a free
Likewise.
strategy, yes, a free strategy call. I mean, that's amazing. And I'll tell you something, listeners, that Dr. Shahid is fantastic in the way he breaks things down. He really makes things very, very simple for us as dentists to understand what is happening, where things could be breaking down, and actually, honestly, you help people arrive to the solution themselves, which is a very unique ability that you have, Dr. Shahid. So thank you for that,
Yeah.
because there are not that many people who can, lead the way, and then you learn to come to the conclusion yourself. So
That's,
that's
that's how
huge
that's
power.
part of selling dentistry too, right? We know the answer, but we have to get the patient to say yes. So
Yeah, no, I love it. I love it. Well, thank you very much for joining us this today, and we look forward to keep connecting with you in the future. And so congratulations to all your success, and go Practice Success Academy.
yeah, well, thank you for having me.
Thank you.